Hey everyone, welcome to GrowMed. In this video, we will discuss the important points related to the forensic medicine asked repeatedly in the Fmge. Every year, there are 10 to 12 questions approximately coming from the forensic medicine. And the questions are almost repeated every year, so it is very easy to practice questions. Okay, so let's see the important topics which you must know. So starting with the mechanical injuries, the mechanical injuries classified into the abrasion, bruises, laceration and contusion. So match-based questions are frequently asked, and also the features which we see in the abrasion, the bruises. So you need to know all this. Like the abrasions, they are most common with the road traffic accidents, and they are classified again into the scratch and the graze. Graze and the scratch and graze are seen with the road traffic accident. And there are also other classification like the pressure abrasion and the impact abrasion. So you need to know in which kind of situation these marks are seen, like the pressure seen in the ligature and the bite. Then questions are asked on the aging of the abrasions. Looking at the color of the abrasions, you can see what age it is. Like for the less than 12 hours, it is bright red, and 12 to 24 hours, it is reddish. 2 to 3 days, it is reddish brown. So you need to know the color also. Then moving on the bruises. Bruises, it is the swelling. Swelling is seen in the bruises and the collection of the blood due to the dermal capillary. Due to damage to the dermal capillary, there is a blood collection seen, and it is of various types like superficial, deep, ectopic, and pattern. So you need to know these points from the bruises, and also questions are asked on the age. Like you need to know, based on the color, you need to identify how much old is the bruise. Like if it is fresh, then it will be red color, and it is due to the oxyhemoglobin. Then after 3 days, like until 3 days, it is blue color due to the deoxygenated hemoglobin. And then on the day 4th, it will be brown color due to the hemorrhage, and 5 and 6 greenish, and on day 7, it will be yellow. And you also need to know because of which pigment this color is seen. Then lacerations, you need to know the types of the laceration, the split laceration, stretch, and the eversion. On the lacerations, usually image-based questions are only asked. Then moving on to the contusion. Contusion is ill-defined. The margins of the contusion, they are ill-defined, and you can see the extravasation. Okay. Then moving on to the next topic, the gunshot injuries called as the ballistic. So from this topic, you need to know the types of the gun, the shotgun and the rifle gun. So you need to know that why it is called as a shotgun and the rifle gun. And on the shotgun, the barrel is smooth, and in the rifle gun, the barrel is rifled. Then types of bullets used in the shotgun and the rifle, you need to know about this also. And you need to know the composition of the gunpowder. There are 3 types of the gunpowder, the black, then the smokeless and the semi-smokeless. So you need to know the contents of this. Like in the black, there is charcoal, potassium nitrate and sulfur. And in the smokeless, there are 3 components present, the nitrocellulose, then the nitroglycerin and the nitroguanidine. Then questions are repeatedly asked on the range of the shot, like it is contact range, near range, contact range, or distant range, or close. So you need to know this. Like if it is close, then there will be burns seen due to the flame, and there will be even blackening due to the smoke, then tattooing, and also the abrasion and the grease color. All the things are seen in the close. And in distant, you can see only the abrasion color and the grease. And if it is a contact, then you can also see the mark will be like this, a stainless shape, and you can see the burns around it, the blackening, tattooing. All findings are found in contact. Likewise, in the near also, you need to know the findings. Image-based questions are asked. Image can give you an image and ask you to say the range, whether it is a contact or the close or near or distant. And also questions are asked on the entry of the bullet and the exit of the bullet, because during the entry, there will be margins will be inverted, and there will be blackening seen, burn present, and tattooing. And the questions are asked on the exit wound also. The margins are inverted, and there will be tissue protrusion like fat coming out or the momentum coming out. Then there will be bleeding present. So while looking at these pictures, you will be able to find whether it is the entry wound or the exit wound. So these were certain important points you need to know about the gunshot injuries. Then moving on to the blast injury. So the blast injuries are classified into the primary, secondary, tertiary, and quaternary. The primary is the blast wave. Then secondary, the flying sharpness, 3 victim displacement, and miscellaneous factors like the asphyxia and the burns. And in the blast waves, usually questions are asked which organ is affected more commonly. It is the tympanic membrane. Then after that, The lung is the second most commonly affected. Okay, so these are certain points you need to read about the blast injury. Then moving on, the hesitational cut. Hesitational cut means they are the intentive or the suicidal cuts. These are suggestive of the suicidal, and how do we find it? They are present in the accessible parts of the body, and these cuts will be multiple and parallel, and they are not that deep. So by looking at these features, you can identify that it is a hesitational cut. Image-based questions are also asked, and it is a very important topic, frequently repeated. Then there are certain findings which are suggestive of the homicide, like the chop wounds, genital injury, defense wound, and overkill. Defense wound are mostly found in the accessible parts like the hand. There are multiple cuts, and genital injury, injury to the scrotum. Okay, these are suggestive of the homicide. Usually image-based questions are asked. Then moving on to the burns. Burns also a very important topic. Questions are asked on the antepartum findings and the postmortem findings of the burns. Findings of the burns classified into the external findings and the internal findings. In the external findings, you can find positive fluid in the blisters and inflammation present, redness, and increase in the enzymes. And the internal finding is the carbon in the airways, deposition of the salt in the airways, and the carboxyhemoglobin. So these are the findings, very, very important, seen in the internal findings, suggestive of the antepartum burns, and multiple times this question is asked. And you also need to know certain non-specific signs like the heat stiffening, rupture, hematoma. These are the non-specific findings and can be seen even in the postpartum burns. Then moving on to the electrical burns. The most common cause of the electrocution is, the most common cause of death in the electrocution is the ventricular fibrillation, repeatedly asked one-liner. And then second most common is the respiratory distress. Okay. Then questions are asked to which kind of features are seen with the AC burn and the DC burn. So with the AC burns, you can see the jowl burns, and on the high voltage, except high voltage, then you can see the flash or the crocodile burn. Image-based questions are asked. Then with the DC, you can see the Lichtenberg flower or seeing green burn, and it is usually due to the lightning, thunder lightning. So these are certain points you need to remember about the burns. So asphyxial death, asphyxia means pulselessness, and you can see various types like the hanging, strangulation, ligature, smothering, and the throttling. So hanging, as we all know that it is of two types, the typical and the atypical. So you need to know the findings found in the typical and the atypical. And there are also findings, postmortem findings. Questions are asked on this, like externally, you can see certain features like the saliva dribbling from the mouth, then the ligature mark, and the la facie sympathetic, and the la facie sympathetica, and the internal findings like the hyoid fracture of the hyoid bone, then the C2 fracture. If there is fracture of the C2, then it is called as the Hamben fracture, seen usually in the custodial death. Then there is a carotid artery tear and Simpson's hemorrhage. So these are the findings which you find in the asphyxial death. So usually questions are given like giving all these features and ask you to make the diagnosis whether it was a antepartum hanging or a postmortem hanging. Like whether the person was alive during the hanging or after killing he was hanged. So we can differentiate whether it was a homicidal or a suicidal. And questions are usually asked on the ligature mark. Which kind of ligature mark we see when it is hanging? Then we can see the oblique, incomplete, and above the thyroid. Okay, so hanging are very, very important topic. Then the strangulation. Strangulation is also classified into the various types like the ligature strangulation with the ligature, then manual, which is also called as a throttling, then garroting, and mugging. Mugging means with a fura. And when there is throttling, you can see the nail marks, which are called as a 6 penny beads, which will help to identify that the person was killed by throttling. Then questions are asked on the ligature mark seen in the strangulation. It is transverse, complete, and below the thyroid. Then other type of killing, the smothering and gagging or choking. These are the suffocation. The death of the person is due to the suffocation, and smothering means using a pillow. Smothering using a pillow and covering the mouth. And the gagging means using a cloth, putting the cloth into the mouth of the face. So these were certain points from which the questions are asked from the asphyxial deaths. Asphyxial death a must be topic. Then another very important is the drowning. Drowning is classified into the dry drowning and the wet drowning. Dry means it is due to the death of the person occurs due to the laryngeal spasm. The vocal cords close and the person is not able to breathe. So laryngeal spasm is the cause of the death. But whereas in wet, the person dies due to the ventricular fibrillation. And if it is cold water drowning, then the patient will die because of vagal inhibition. So these were certain important questions asked from the drowning topic. And also there are certain tests done, like the diaphragm test and the Jetler's test. So you need to know about these also. And the findings which you can see if a person is died due to drowning, it can be external findings and the internal findings. As external means glass clenched into the grass clenched into the hands, and there will be froth coming from the nostrils. These are certain specific signs which you can see and confirm that the patient was alive by the time of drowning. And the internal findings are like the lung volume increases and there will be edema present, mud in the lower airways and water in the middle ear, in the stomach and in the intestine. So these are certain signs which confirm that the patient was alive during the drowning. Then certain non-specific findings are the washerwoman's hand and acute case and acidina. These are non-specific and we cannot say that the person was alive or killed. So these were the certain points which you need to know from the drowning. Then moving on to the certain postmortem changes like the algor mortis, rigor mortis, the eye changes, the decomposition. Okay. Algor mortis means it is postmortem cooling, when the body cools down. So questions are asked on the curve and it is the sigmoid curve or S shape, and the instrument which we use is the thermometer. And in certain conditions, the body do not cool after death also, and that condition called as the postmortem caloricity, and you need to know the in which conditions it is seen, like the tetanus, then defective thermohemoglobin, heat stroke, puncture hemorrhage in the burns, in the septicemia. Then the liver mortis is the pigmentation, postmortem staining. Okay. In the dependent parts of the body, the blood will go and accumulate, giving this staining. The questions are asked like when does it start? So it starts in 30 minutes to the 2 hours and completes in 6 to 12 hours. And in conditions like the anemia, severe anemia, and if there is massive bleeding, then these conditions this is absent. This liver mortis is not seen. And the questions are asked also on the color, like in which if there is any poisoning, which kind of pigmentation is seen. Like normally it is the blue color or the purple color, but in CO poisoning it is the cherry red, and in the cyanide poisoning it is brick red. So multiple times this question is asked: cherry red and brick red. The rigor mortis is the post-mortem stiffening of the muscles, and the cause is due to the reduction in the AFib. So there are 3 phases: the primary relaxation, and then the rigor mortis is seen, and after that the secondary relaxation. Usually the questions are asked on the first site. First site is the myocardium, and if the question is asked the first external site, then it is the eyelid. And this rigor mortis follows a rule that is the Nastens rule. So these are the certain one-liners asked from the rigor mortis which you must know. Then moving on, the eye changes seen after the death. So we can see the Kevorkian sign on the retina. It will be like this, breaks between the blood vessels like this, because the bleeding has stopped. Okay, this is also known as a railway tracking sign, and it is seen within the minutes. Then tachynoir sclerotica, it is seen on the sclera due to the collection of the dust particles. If you don't close the eyes, then there will be this is the shifted, so some certain triangle kind of a thing seen with dust accumulated in it. Then moving on, the most important finding is the increased potassium level in the vitreous humor. It is used for the estimation of the time since death and considered as the best parameter. Image-based questions are also asked, so you need to look at the images also. Then decomposition of the body occurs by the autolysis through the lysosomal enzymes or occurs due to putrefaction due to the bacterial enzymes. It occurs due to the enzyme lecithin is found in the bacteria. So questions are asked on the first site, and it is the larynx and the trachea. During the decomposition, a classical finding is seen that is the marbling, asked multiple times. A very, very important topic, marbling. Image-based questions are also asked. And this marbling is due to the sulfhemoglobin. So these were the certain important points asked from the decomposition, which you must know. Then moving on to the IPCs, you need to know the number and what it stands for. Like, a very important one-liner asked is the 84. IPC 84 stands for the McNaughton's rule, and it states that if a mentally ill person commits any crime, then that will not be considered as a crime. So likewise, you need to know certain other IPCs like 304B stands for the dowry death, 304A stands for the medical negligence shown by the doctor due to which there was death of the patient. Then IPC 319 says about the hurts, and for the grievous hurt, it is 320. So as there's a lot of IPCs, so I cannot cover in this, so I will be posting a video based on the IPCs which you need to remember. Okay. Then moving on to the inquest. In India, there are two types of inquest, the police inquest and the magistrate. So you need to know which kind of inquest is done by the police and the magistrate. Like, if there is dowry death, then the magistrate will do the inquest. And in case of a custodial death, also the magistrate will do it. And you also need to remember the CRPC number for this. Like, for the magistrate, it is 17.6, and for the police, it is 17.4 CRPC. Okay. So these are certain points which you need to see for the inquest. Then moving on to the skull fracture. You need to know the types of the skull fracture. Like, there are the fawn fracture, then fissure fracture, which is a linear fracture, then ring fracture seen in the posterior cranial fossa, and the cutter fracture. Usually questions are asked on this cutter fracture. It is caused by oblique bullet. Okay, so these are the fractures which you need to know. And there are other certain fractures like the depressed, also known as the signature, comminuted, and the sutural diastasis. Image-based questions are asked. They'll give you the image and ask you to say the type of the fracture. And usually questions are also asked on the brain hemorrhage. Brain hemorrhage is a very important topic. I've already posted a video on my YouTube, so you can go and find out the brain hemorrhage. Along with the images, I have posted it. So it is a must-do topic covered in a lot of subjects like the medicine, surgery, radiology, and even in the FSM. So there are three types: the EDH, extradural hemorrhage, then the subdural hemorrhage, the subarachnoid hemorrhage. They can give you the findings and ask you to identify from where it is bleeding, or they can give you the image-based question and the head, CT of the head, and ask you to make the diagnosis. So moving on, human identification. The best method for the human identification is the dactylography. This is the fingerprinting. You need to know the type of the fingerprints, like the loop, which is the most common, and then others are the arch, then rolls, and the composite, which is the mix. Image-based questions are asked, so you need to know which kind of fingerprint looks like what. Okay, then other ways to identify the human: the race, the sex, and the age determination. For the sex determination, it is best if we do it by using a pelvis. It is almost 98% accurate, 95% accurate, and it is the best. And if we add along with that skull or long bone, then it will become 98% accurate. Okay. And for age determination, we will be using the teeth, the dentation, then. So there are various one-liners asked from this, that the Gustafson's criteria, then the Boyd's criteria, then the Stack's formula. So you need to know for which kind of, when are these used. There are also other methods to find out the human identification for the human identity. There are also various other methods for the human identification, like the cilioscopy, which makes the lip prints, then the podogram, the footprints, and the superimposition. Superimposition, skull image is imposed on the missing person's image, and both are looked if they are matching. And this is a very important one-liner, and the image-based questions asked previously. Superimposition. Okay, so you need to know all the points related to the human identification. So moving on to the toxicology, very important topic, and one question is asked from the toxicology every year, 1 or 2 questions. So you need to know everything, all points about this. like the arsenic poisoning, you need to know the features which are seen in the arsenic. So these are the findings seen in the arsenic poisoning: the raindrop pigmentation of the skin, and it is due to the hyperkeratosis, increase in the keratin, then ulrich maze nails, and neuropathy. So if these all findings are given in the question, then you need to mark the answer as the arsenic poisoning. Then moving on to the lead poisoning. So these are the findings seen in the lead poisoning: microcytic anemia, along with that the basophilic swelling of the RBCs, then the Burtonian lines, wrist drop and foot drop, and encephalopathy seen mostly in the children. So questions are also asked on the antidote, or for the management we will use the ADCA and DMSA. So these all points will be described in the question, and they'll ask you to identify the poisoning. Then moving on to the snake, the types of the snake you need to know. The types are the Eladepiae family, Vipridae, and Hydrophidae. Then they are the cobra, the king cobra, then the Russell viper, then sea snakes. Okay, these are the certain snakes which are venomous, and you need to know which kind of poisoning is caused by this. Like if a cobra bites, then it is a neurotoxin, so it will cause respiratory paralysis. And if the Russell viper, then it is a vascular toxin. And the snakes, it is a myotoxin. Okay, so these were certain points from the snake family, and you need to also look for the images. So moving on to the plant irritants. So questions are asked on the irritants. Usually one-liners are asked. They'll give the image and ask you the active component of this. The active component of the seed. Okay, like you need to know the ricinus, then the raticides, and the bivala. Bivala is used for the artificial bruise. It is used to create the artificial bruise. So moving on to the next topic, the alcohol. Questions are asked on the poisoning, what kind of features are seen, and the management. How do we manage a patient with the alcohol? So the drug of choice is the fomepizole, and if it is methanol poisoning, then we will give IV ethanol. Okay, alcohol is also a very important topic because asked from various subjects, so based on its features, like we can see cognitive encephalopathy, and then if there is withdrawal, then we can see the tremens, then delirium tremors. Okay, so all these are very important topics, and alcohol a must topic. Let's see certain drug poisoning, like the dhatura. The active agent is the hyoscine or the atropine, so it will cause the anticholinergic feature. And for the treatment, we will use the physostigmine. So there will be a clinical case describing all these features, like the cholinergic features, the anticholinergic features, the meiosis, mydriasis, the secretions are increased or decreased. You need to look for these features and find out the exact cause for the toxicity. Then in cocaine poisoning, you can see the sympathetic activity, increased sympathetic activity, and whenever you see this, then you need to mark the answer as the cocaine. Then certain findings are seen, like the black tongue, and in the drug abusers who snort it, in them there will be septal perforation seen. Then moving on to the cannabinoids, there are various varieties of the cannabinoids which are available, like the bhang, the hashish or the charas, and the ganja. So the active component of the cannabinoids is the tetrahydrocannabinol. And the opioids. Questions are asked from the opioid poisoning mainly. They will describe the pinpoint pupil, and describe the findings, like the secretions is increased or decreased. Okay. Then you need to identify it as opioid poisoning. And antidote questions are asked on the antidote, and the antidote used for this is the naloxone. So this toxicology part are very important. Always one question is asked from this. Okay, then let's see for certain miscellaneous points, like the test for the blood stains. So these tests are done to identify the blood stains, and they are the spectroscopic, which is the most specific and the most confirmatory. One manner asked previously. Then Takayama's image-based questions is asked. In this, the blood stain will look like a salmon peak feathery crystal. Then the benfading test, which is the most reliable test, and the Jesselmeyer test. Then moving on, let's see a certain paraphilias. So questions are asked on the paraphilias, like the exhibitionism. So you need to know the definition of these paraphilias. Usually definitions are asked. exhibitionism, fetishism, scatologia, scatophilia, then zoophilia, necrophilia, transvestilism. So these are certain paraphilias which you need to know the definition, and questions are asked describing the case, and they'll ask you to identify which kind of paraphilia it is. Then the various other topics also questions are asked, like the medical termination of the pregnancy after 2021. So you need to know all the points related to this. Then the methods of the autopsy, and you should know which kind of chemicals are used in during the autopsy, and you also need to know the incisions made during the autopsy. So this was a list of the important topics which you need to learn before going to the Fmge exam. So most of the questions are asked from this list repeatedly. So thank you so much guys for watching this video. If you like it, please subscribe to my channel, share it with your friends. Thank you. Bye-bye.